In 2017, Rhode Island reported opioid-related deaths at nearly twice the national average. Many of you work in the healthcare field and have seen the prevalence of opioid use and addiction firsthand. With the high use of opioids for pain relief comes the risk of overdose. Narcan is an opioid antagonist, meaning that it can reverse or block the effects of other opioids, such as heroin, morphine, oxycodone, and fentanyl. As a registered nurse who has worked in 2 hospitals, a rehab, and an outpatient group home setting, I've administered several forms of opioid medications. I've seen the relief these medications can bring to patients suffering from severe pain, but I've also seen the addictive qualities for patients, where patients will be tired from the effects of the opioids, but set an alarm so that they wake up on time to request their next dose. Or rate their pain 10 out of 10 whenever they're asked. The opioid crisis is a term used to describe the increase in overuse, abuse, and overdose deaths caused by opioids. And naloxone is a drug used to prevent or reverse opioid overdose that can be administered as an injection or a nasal spray. The opioid crisis is a term used to describe the increase in overuse, abuse, and overdose deaths caused in part by the use of opioid medications. The community first responder naloxone Narcan training is a brief online course available to educate on the indications and administration of Narcan. Narcan is used to reverse the effects of opioids on people showing signs of overdose, like bluish skin, slow to stop breathing, pinpoint pupils, or unconsciousness, by either injecting the medication intramuscularly or spraying a solution into the nose after calling 911. The opioid crisis is a term used to describe the increase in overuse, abuse, and overdose deaths caused in part by the use of opioid medications. Opioids are used by a wide variety of people. Opioids are used for patients experiencing moderate to severe pain when other treatments don't relieve the pain. Opioid use impacts all ages, sexes, ethnic, and socioeconomic backgrounds, and especially those in rural settings. In 1996, to address the perceived undertreating of pain, the American Pain Society campaigned effectively to include pain as the 5th vital sign, so all patients who are asked to rate their pain rating. Self-reporting pain alone is inherently subjective, so pain treatment requires a multifaceted approach. Medical cannabis is one alternative therapy to opioid prescription that remains taboo in the medical community. According to perceived efficacy, reduced prescription drug use, and minimal side effects of cannabis in patients with orthopedic pain, 73% of patients studied either ceased or decreased opioid consumption, and 31% discontinued benzodiazepines. 52% of those did not experience intoxicating effects. My partner has chronic kidney disease and experienced pain unrelieved by Tylenol and unable to take NSAIDs. And his pain was relieved by CBD gummies and vaporizers. Rhode Island is greatly impacted by the opioid crisis. According to prescription opioid prescribing in Western Europe and the United States, overdose deaths are 7 times more common in the US compared to Western Europe. From January 1st, 2019 to December 31st, 2021, 965 individuals experienced a fatal opioid-involved overdose in Rhode Island. That means that in Rhode Island, someone dies almost every day from an opioid-involved overdose. In 2017, Rhode Island reported opioid-related deaths nearly twice the national average. Fentanyl is a highly potent and synthetic opioid that was first detected in Rhode Island in 2013. Of the 965 fatal overdoses between January 1st, 2019 and December 31st, 2019, 86% of those involved fentanyl or fentanyl analogs. You might be thinking, this sounds terrible, but what can I do? Well, the Community First Responder Naloxone or Narcan training is a brief online course available to educate on the indications and administration of Narcan. This training educates on how to recognize a possible overdose. A study published in the JAMA Network Open Medical Journal states there's estimated over 63,000 people in Rhode Island at risk of opioid overdose. Education and messaging campaigns can change attitudes about opioid use, including empathy, destigmatization, and perceived risk. The community first responder, naloxone or Narcan training, teaches the signs, symptoms, and risk factors for a bad reaction to opioids. Those at risk of opioid overdose include people with a history of substance use disorder, combining opioids with alcohol or benzodiazepines, chronic opioid use, respiratory conditions, and more that are outlined in the training. Slow breathing, trouble waking up, and changes to skin tone are all signs that a person may have overdosed on opioids. Changes in skin tone, such as grayish or ashen to bluish purple, indicate that the person isn't getting enough oxygen. The community first responder, naloxone and Narcan training teaches how to react when witnessing a suspected overdose. Naloxone is an opioid antagonist medication that is safe and effective in reversing an opioid overdose. Rhode Island enacted overdose-related laws to remove barriers to naloxone access and rescue, including naloxone dispensation, understanding orders, pharmacy-based naloxone access, and Good Samaritan laws. A study about the role of naloxone distribution in Massachusetts, Rhode Island, and New York City concluded that additional prevention, treatment, and harm reduction interventions are required, and dramatically higher naloxone volumes needed to reverse the opioid overdose crisis in the United States. When you suspect someone may have overdosed, the first thing you want to do is try to wake them up. Call their name and run the middle of their chest with a closed fist. If the person doesn't wake up, call 911. Calling 911 first will ensure you have the needed support on the way, and a dispatcher will be able to help guide you. So, how and when do you administer Narcan? Narcan is used to reverse the effects of opioids on people showing signs of overdose, like bluish skin, slower stopped breathing, pinpoint pupils, or unconsciousness, by either injecting the medication intramuscularly or spraying a solution into the nose after calling 911. Naloxone is available to restore breathing in people experiencing an opioid overdose. As I mentioned, when you suspect someone is experiencing an opioid overdose, the first thing you should do is try to wake them up. Call their name, and if they don't respond, give them a sternal rub by rubbing their sternum with your closed fist. Call 911. The 911 operator will guide you in starting CPR and administering naloxone. To administer naloxone nasal spray, remove the dose from the packaging, insert deep into the person's nose, and depress the plunger. To administer naloxone intramuscular, remove the vial cap and withdraw the full contents of the vial with the syringe, making sure to avoid touching your bare hands. Expel the air from the syringe, clean the area of the muscle, and inject the solution at a 90-degree angle. More than one dose of naloxone may be needed, so it's best to wait 2 to 3 minutes between doses. When administering the second dose of Narcan nasally, insert into the opposite nostril from the first dose. When administering the second dose of Narcan intramuscularly, inject the syringe into another muscle or the opposite arm. The opioid crisis is a term used to describe the increase in overuse, abuse, and overdose deaths caused by opioids, and naloxone is a drug used to prevent or reverse opioid overdose that can be administered as an injection or nasal spray. The opioid crisis is a term used to describe the increase in overuse, abuse, and overdose deaths caused in part by the use of opioid medications. The Community First Responder Naloxone Narcan Training is a brief online course available to educate on the indications and administration of Narcan. Narcan is used to reverse the effects of opioids on people showing signs of overdose, like bluish skin, slower stopped breathing, pinpoint pupils, or unconsciousness, by either injecting the medication intramuscularly or spraying a solution into the nose after calling 911. With the high rates of opioid prescription in the community, as well as illicit drugs being contaminated with fentanyl, it's more important than ever as a Rhode Islander to be informed, and prepared in case you witness an opioid overdose. Thank you for your time.